Welcome, everyone. Again, thank you for joining the Minnesota Public Health Association in our special session today, From Community Engagement to Community Governments, Co-Design and Practice. We're really excited to have our speakers with us. I will let them introduce themselves and just wanted to go over a couple housekeeping. It's the standard Zoom things. Feel free to introduce yourself in the chat also. Would love to know which part of the state you're joining us from. And feel free to rename yourself as well. We will be watching the chat, so if there are any questions or comments, feel free to put them in. And I'll start with our ancestral land statement. We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and United States governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself. And with that, I'm going to stop sharing my screen and let our presenters take it away. Jess, go ahead. Thank you.
Great. Everyone see the slide?
Yes.
Perfect. Well, I will um, jump into things, but first I want to have my colleagues introduce themselves, maybe Atreya and then Holly.
Perfect. Yes. Thanks, Jess and Mary as well. Hello, everyone. My name is Atreya Madrone. I use he, they pronouns. I was one of the original co-design team members for the project that we're going to be kind of chatting about today. So excited to be here with you all.
Hi, everybody. My name is Holly Jones. I am a program manager within Olmsted County Public Health. I oversee the performance management, quality improvement, and accreditation unit. So in our world, the community health assessment and planning process kind of covers our CHNA and our CHIP that resides on my team as well. So that's kind of how that work connects into my team. So super excited to be here and share our work with you today.
Great. Thank you. And my name's Jess Roberts, he, him. And I run by design, and I'll sort of give you a rundown of the type of work that I do with my colleagues being able to share a bit more context to a specific project we worked on. My background's actually in architecture, but I also have a couple affiliations at the University of Minnesota, one in the School of Public Health and one in the College of Design. So to sort of set the stage, I want to sort of recognize a couple things of what this work is. Number one, this work is not new, right? This is simply sort of reaffirming what healthy, thriving societies have always done, which is rolling in lived experience and collective decision making into how decisions were made, basically, right? We also know over history, when that balance gets out of whack, that societies tend not to be so healthy or tend to sort of struggle. And we can see, I think, similar pushback and conflict right now where we have a disproportionately small number of folks that tend to make decisions on behalf of communities they tend not to be part of, and in many instances tend to be furthest away from the impact of the very decisions they're making on behalf of folks. And so I know in public health, we often talk about um, designing or working with community and not for. Co-design really is about ferreting out what does that distinction really mean and how does that actually show up. Number two, this is an equity problem, right? So equity is not only the measurement of outcomes and access, it is about the process, right? Who feels safe and can participate and have standing in a process like this, whose knowledge and lived experience and cultural realities actually counts in that process, and whose authority or influence is recognized in the process to be able to influence these things. And then finally, this is a simple sort of design problem from my background. Systems simply reflect the assumptions, the biases, the perspectives, the experiences of the very people that get to make the decision. Um, and it tends to misread how communities frame certain challenges, how they drive change and seek solutions, and even the assets they might have in place to address these things, particularly when they live outside of the formal structures and institutions. So this is from the water of systems change, and that it's the conditions of systems change. And so I think this is a great illustration because most of the work we do, particularly in public health, right? We work on policies and programs and practices and seek for to sort of what are the resources, where do these resources get allocated? And we take an equity lens. We might take an equity lens to doing those things. But the real driver is what's happening below that level, right? At that relational change level. And so what's the quantity and quality of those relationships and connections to doing this work? More importantly, what are the relationships to the power dynamics, the decision-making power and influence in making those decisions? And so this is really where co-design works, right? It's sort of diving deeper to sort of connect and understand how these policies and practices and resource allocations show up in people's daily life or not, and then shifts some of that power sharing, shifts that the decision-making power to include lived experience. And I've actually found that in doing that work in co-design is a really effective way to start to shift some of those mental models that keep these relationships in place, right? Or the heart of why people determine who participates, who has influence. And so the co-design work recognizes that no amount of talking shifts that mental model. It is by doing and working and building relationship and connection that you then start to shift some of those mental models, which then again allow additional opportunities for those relationships and connections to grow, which is again sort of the primary outcome. It isn't just a project, it is what sustains and bridges those projects we might be doing. And so that's what co-design, really high level, is. It is creating the structure, the opportunity, the recognition, the compensation, to bring folks with that lived experience into the process as governance, not just the input that gets extracted and interpreted by a subset of the population. And so to sort of draw a bit different distinction here, and when I cite sort of traditional community engagement, that isn't to suggest that co-design is a superior form of engagement. It is simply trying to draw the distinction between where co-design might live along that continuum of engagement activities because as Holly will probably help illustrate, like we build most of our co-design work on the community engagement that's already, informing what are the problems, who's most disproportionately impacted, to what degree. And so in traditional community engagement, some of the limitations are number one, we hear from the usual folks, the usual suspects that show up reliably, right? I think research suggests it's the 20 percenters that you always hear from. They're really accessible and may not be a great reflection of the broader, more dynamic communities they're part of. And it places a burden on the people that do show up to be that token representative of the communities that they're part of. So, but in co-design, we are really strategic about, drawing from what we know in the data, who are the folks we are not hearing from reliably, and who are the folks that are disproportionately affected by these issues. Not surprisingly, those things tend to be quite closely aligned. But in co-design, we actively recruit for those folks. So the folks that wouldn't self-identify, they're not the loudest voices in the room. And we recruit them not just because of the lived experiences that they bring, but because of the communities they're actually part of and the relational networks that they're tapping into. And so in the co-design process, co-designers are conduits to the community. They are having conversations with people they already know and have relationship with, that we wouldn't be able to reach otherwise through, surveys or listening sessions. And then not just bring that information forward, but interpret that information. So it isn't just here's a bunch of data I collected, now have someone without that lived experience interpret it. They themselves are interpreting and synthesizing and prioritizing it through a shared lived experience lens. So we're sure that we're not extracting, right? It's that doing with instead of for, so that the lived experience is the guidance through this. And we do this in multiple iterations. So it isn't just one conversation. We're able to build on that and go deeper within these communities. So another way to sort of pull out or sort of recognize some of the differences in traditional engagement, a couple things are in traditional engagement, too often we're going in with a hypotheses, which could be dictated by the research we're doing or the grant we got, and it tends to fall into more of a validation rather than in co-design. It is truly about that exploration and reframing those assumptions we had going in that we didn't even know we had, right? It is about engaging those folks who are not the usual suspects, the folks that are most difficult to reach, and tapping them to be able to be access additional voices and experiences in those communities. It's about balancing the lived experience and learned expertise, recognizing that they are both very valuable data sets. And too often we make those decisions without the lived experience truly being honored in a reliable way in that process. It is reframing between, asking people what they think versus understanding what people feel. So their hopes, values, fears, which we find is a much more accurate representation of what people care about or what drives them. Um, and it is about instead of this hope of consensus building by bringing folks together, it is of finding where these differences exist, being really intentional about these differences, because if you have consensus in a space, you just have invited the wrong set of folks because there shouldn't be universal agreement. And so it's about setting those productive tensions where we can recognize and explore those differences, but they're not too extreme that people can't engage safely. And so one of the examples that that Holly and Atreya will be sharing a bit more about was a LGBTQIA project in Rochester in Olmsted County, that was informed through community health needs assessment that identified the priority areas and recognized that this community in particular had the greatest disparities across those three sort of priority areas. And so through the co-design process of, iterative exploration sessions and then refining outcomes, a couple things emerged as sort of intervention opportunities. One was that trust travels through peer networks, right? People trust people. They don't trust institutions or marketing, or as one of the quotes here noted, just because you have a rainbow flag did not make a space safe. And so one of our co-designers actually took a summer internship at Olmsted County and built out a peer-reviewed, you know, uh, built a peer-reviewed digital resource tool that linked all the different resources that were found safe and rewarding for folks that have used it already. Training must be built through that relational capacity, not compliance. So while we while we understood that providers needed better capacity for care with this community, we couldn't have the sort of binary do's and don'ts list of like how to provide care, how not to provide care. So instead, the co-designers themselves built out vignettes of lived, it was sort of narrative-based training modules that were rooted in real life experiences that were really about spurring conversation and humility and curiosity around those trainings. Our co-designers are now being compensated to deliver this training. They've delivered it at Olmsted County. They're delivering it at within Mayo Clinic. And again, that they're the ones actually not just building or coming up with these ideas, but delivering that. And then safety is felt but not declared. So this is sort of the recognition that, again, that lived experience, trust is through that lived experience and shared decision making. One of the other concepts was a peer navigator that's sort of in a holding pattern with some of the governmental changes and funding structures, but still sort of an important component of this. And then I think the key takeaway being that your community members, our co-designers, the folks they connected with, really are not just recipients, right? The sort of recipient of these outcomes. They are the ones that are actually driving the interventions, delivering it. And I think that's what matters most, is that the co-designers are now in a place where they are the face, they're being recognized, they're being compensated, they're delivering this. We're going to NACHO in a couple weeks where we'll be presenting on this with our co-designers, sharing this work. And so I think you recognize that, again, going back to this diagram, how co-design builds those relationships and connections, shifts some of those power dynamics, starts to alter some of those mental models, and really is about changing that relational layer of how we do the work, not just what the work is, this outcome, but what happens after you've come up with these outcomes. And so this is where I'll have Holly and Atreya share a little bit more perspective of what this work look and feels like, both going through this as well as, as we continue to sort of deliver this work.
Yeah, so from Olmsted County's perspective, it really was about like shifting into that like discomfort and out of what was traditionally done, and primarily handing over kind of that decision-making authority to our co-design team. So for example, like in a typical situation prior to engaging in co-design, we would probably convene a work group that would be tasked with working on whatever needed to be improved. So like our three priorities are access to care, mental health, and drug use. We'd probably have work groups for those. So those work groups would probably leverage like designing for mostly. So that was one way right early on that we had to like give up that decision-making authority. Then once we kind of got going along the path of co-design, had to look at like if there was a decision to be made, was it one that I could justly make, or was it one that our co-design team should be making? So just some examples of that, like when Mayo came back to us with sharing a subset of the training at grand rounds instead of the full training. I kind of, my initial reaction was, no, that's not what our co-design team wants. But I caught myself making an assumption. And after kind of calling myself out on that, took that opportunity to the co-design team, and they made that decision that yes, that was something that they wanted to do, and proceeded along that path. So I have lots of different examples of how that kind of decision-making authority kind of transferred out of the public health hands and into our co-designers' hands. But I think Atreya can shed some light on some of that as well, as far as how it felt to be the decision-making body.
Yeah, wow. Thank you for that amazing segue, Holly. Yeah, so I guess I'll give just a quick, little bit of background. Like I said, Atreya, co-designer. I was really excited about this project when I learned about it, because for a couple of reasons. When I was in high school, I did peer-led sex education, and I knew really how powerful kind of peer-to-peer methods could be. So I kind of had that foundation and was excited about that. And then later now, professionally, I'm a librarian, and I support research. And so, of course, I know about and, value different types of research methodologies, particularly like community and action-based research. But really getting to experience the co-design process is something kind of unique and distinct. was really impactful and powerful in ways that was kind of surprising and exciting. And then, of course, kind of a return to my peer educator roots in a way, which was really exciting. I often say that it's collaboration and accountability are kind of the two big aspects of this process that I find to be kind of the most impactful, which have already kind of been touched upon by Jess and Holly. But to kind of start on the collaboration piece, it always just really felt nice. Like I was excited to come and do this work because it was a group of queer and trans people like myself coming together where we were being centered as contributors and as experts. And so, because I think traditional consultation methods and research methods and things can often feel really isolating. Often it's like you're just filling out a survey on your own, or it's like you're doing an interview, you're being studied, or you're kind of in a focus group and you're sitting in a room and you're kind of just like kind of more clinical. But this is, whereas we were just meeting up and chatting about our thoughts and what we learned from other people in our community and our own experiences. And so then we were able to discuss with each other, learn from each other, build upon what we were saying. And that was really amazing and like really incredible. And then because we were a dedicated group, Holly spoke, really perfectly to this. The co-design process really required Holly, Jess, and then the other team member is also named Jess, so we called them Little Jess. But it really required the three of them to really remain accountable to us in a way that like filling out a survey doesn't require. And so we were real people that Holly was seeing, pretty regularly and hanging out with us and chatting with us, knew our names, knew what we were saying. And so that meant, therefore, that Holly had to go back to the county and the county had to keep us in the loop, right? Like we were a dedicated group. So that's pretty powerful. I think already so far, I'll say that Jess, I think, has done a really good job of identifying that the co-design methods are really a big mindset and power dynamic shift that to me, once you see it, you can't really unsee in the long run. And so as a co-designer, I felt that dynamic shift most when we were developing our training, which Jess has talked about. And like I had really large impacts on how that training ended up. Like, for example, what Jess was saying about the do's and don'ts of EDIs, like that came about from a conversation I had with little Jess about how I was really frustrated every time I was in a meeting. And they were being like, oh, well, you just do this, or you just think this way, or when you do this, it'll be perfect. And I was like, that's just not how it works. It needs to be a mindset and a value framework that you carry with you. And so then that ended up being a huge part of our training. And then also a really huge part, like Jess mentioned, was the stories, the vignettes that we ended up using to really contribute to that kind of value and contextualizing knowledge and experiences. And those stories are from us. And now that can be really vulnerable for us to share our stories. And that then, because it's so vulnerable, means that it's like basically invaluable resources to people who participate in the training to have real people's stories that they're sharing. And it could have felt really icky to like give those stories over and just like not know what happens to them. But instead, a few of us got to come along and we all had the opportunity to present and be facilitators and join in. And so that gives us agency and continued power over our own stories. And so whenever I do a training, I facilitated a few, I get to say like, these are real people's stories. These are my stories. These are people I've worked with stories. And you have to honor and respect them. Like I'm here to tell you that as the voice of these stories. Whereas with other methods, I wouldn't have even been involved in any of this in the long run. And then the last thing I'll say before I pass it back is that, this sort of collaboration and accountability would not have been possible without people like Holly, Jess, and little Jess, who all really value co-design and like wanted to be in relationship with us and like liked showing up and working with us and like wanted to work through those things. Because badly done co-design could be just as harmful, maybe even if not more harmful sometimes than other methods. So what you really need to keep in mind is that you have to be committed to this process, which includes you have to have humility, like Holly mentioned, right? And to be wrong, having your own values tested, and to then therefore be willing to like stand up to whatever institution you're a part of to really be an advocate. and to follow through. And all those things can be really hard and scary. So we need really good people, hopefully, like all of you here, doing this kind of work. So I'll pass it back now to Jess.
Well, that is perfect, Atreya. Thank you as usual. So well illustrated. And I think what Atreya, one of the more important things that come out of this is, we always talk in public health, talk about that accountability and how we measure and assess those things. I can tell you that building relationship is a really difficult thing to not be held accountable to, right? That true, authentic, those relationships and connections, like we're talking about in the systems work, when you shift that layer, when those things start to shift, like the accountability is just baked in, right? Like Atreya mentioned, sharing the story is really something different. If I, not from the community, am sharing someone else's story and not able to even really respond to what was behind that story in those trainings, that's a really different delivery than Atreya or some of our other community members doing that. So I think that accountability, you don't have to think about it, right? It is just inherent in how you're doing this work. And I think so. One of the quotes I got from a different project with one of our co-designers is like, how do you describe co-design to other people? And they said, well, it's being persuaded, not persuasive. And this was a person that lived in a community where they receive a lot of persuasion, right, of how they're supposed to use the system or the level of, health literacy they should have, and really what you're saying is you're living your life wrong and you need to just understand, or the other thing we hear is just, right? Just do this, just call this number, just go to this website, not realizing what the lived experience actually is and what does it actually take to deliver on what this quote says, right? What does being persuaded look like versus being persuasive? And in a profession where, you are expected to have a certain level of expertise, we can fall into the latter pretty easily, right? Or we can hear stories like Atreya is saying and go to the like, okay, how do I just solve for that, right? Rather than really understand what's behind that. And how is the community solving for this already in much more native, culturally appropriate ways? And so the co-design process itself, it has four basic phases. It's not linear, it's sequential, but it's not linear. So the design world is all about iteration. So you just start and you learn your way forward because there's just so much uncertainty that would cripple you otherwise. And so in this work, a lot of times when we're doing our recruitment, we might hear things that suggest we need to adjust our scoping of the work. Or as we're in the co-design work, realizing, oh, here's a perspective I missed, right? And so what I presented this years ago to the Bush Foundation board, and one of the Bush board members asked, like, well, how do you know you've identified the right problem or recruited the right people? And it was one of those moments where I realized like you can't know that, right? If you know that going in, then what's the point? You've already dictated something. But what we do need is a process that allows us to learn those things. Is this the quote unquote right scope of the project or community we're bringing together? We won't know that until we actually start doing that. Until those assumptions, like I said, we don't even know we have, those biases are visible by going through this process. So the process itself is the first one is really building on what we know, right? We're not starting from scratch. There's a lot of information about the communities. There's a lot of informal information through community conversations that organizations are having within communities. So using that to build and focus the work appropriately, because the other thing that isn't helpful is engaging the community around topics that are so broad and so abstract, I can't connect to it, right? Or we get overly generalized output, right? So it's that art of framing it tightly enough that people can meaningfully engage, but broad enough that unexpected insights can emerge through that process. Then it is not just an open call for participation because we know who we'll hear from then. It is being really strategic. We know, again, from the research, who we're not hearing from, who's most disproportionately impacted. And so we connect and reach through existing relational channels to recruit, actively, proactively recruit those folks who will participate as those community co-design conduits. It's sort of like a snowball recruit, right? We get pointed to Nancy, and Nancy's really interested in this work, but can't participate for some reason or doesn't have time, but they know someone that might be a good fit for this. So we reach through those relational channels to identify folks who are a good fit for the work. And that usually starts with some stakeholder mapping. We know in our mapping, we sort of map, overlay a couple quadrants. In the right upper hand quadrant is those who are impacted by the work and have high levels of ability to influence the outcome, so institutional leaders, etc. And then the upper left-hand quadrant, which is folks who are highly impacted by the outcome and have very little ability to influence the outcome. Those are our co-designers. So we're just really strategic about who are those communities, what are those experiences, and then we go through and sort of build personas so that we're really thoughtful about the richness of experiences we would look to include. We do that outreach through those existing channels. And then we set expectations both ways, right? Because how many projects have all of you been on where we oversell and then underdeliver the opportunity, right? This is a great opportunity. We want to hear what you say. And then where did they go? What happened to this work, right? I think Atreya mentioned that. Like, that can be the traditional rhythm of, great, thank you so much for this input. Now we will go somewhere and make decisions on your behalf. Then as a sort of meat of this process, it is the equitable co-design sequencing. So for most of these projects, that means several iterations. So with the project that Atreya and Holly shared, we met 4 different sessions. We bring in 6 to 8 community co-designers that bring in a diversity of experiences. We compensate them professionally. We offer them guidance on the types of questions they might ask, but we sort of work with them to adapt them. It's really open and informal. Then they go out in their communities and have these conversations in the ways and the places with neighbors, coworkers, friends, whoever they connect with, and then bring sort of the takeaways or insights to the next session. And then from there, we are completely following the lead of the lived experience. So we might hear things like, I just don't feel welcome using this resource or going to this clinic. We could write a report and say, wow, we just need to make more welcoming clinics. Or in this process, we get really specific and precise on what does welcoming mean and look like for the community. So the next round of questions might be something like, where do you go now to feel seen and heard and safe? And more importantly, why is it these locations are with these people? So the intention of this process isn't do X, Y, and Z. It's the outcome, the policy, the program, whatever it might be, might not be able to articulate specifically what that is, but I can articulate the lived experience sort of design criteria or guiding principles that must be embedded in that outcome. And this is where that back and forth or productive tension between lived experience and learned expertise is so important, right? Because we want to find the sweet spot between those. Because we can have really great conversations at the community level, but if I can't influence the outcome through that lived experience, then we're just having great conversations without the ability to influence something. So this is all about what within that lived experience can we move forward and actually influence the outcome in some meaningful, impactful way. And then finally, the is the sort of development, implementation, and governance. And this simply suggests that you go through that co-design process. That is not an end point, right? It is ways of bringing the voice, not just the outcomes of that co-design process, but the people themselves into that implementation in a variety of ways. And this is important because it, one, protects the thesis. So those specific outcomes are constantly cross-referenced with the community co-designer, so we don't lose through translation what we thought they were saying or what they thought they meant in these recommendations. Oops. Then it is about building that trust before you jump to the larger scale solution. So we're doing these prototypes. We're testing things in really small, safe, quick ways with our co-designers and some of our sponsors, and then building towards a solution. So our training modules started with a community health worker, a couple community health workers. We just hop on a Zoom and try it out and see how it feels, what we might change before we start scaling it up for larger audiences. And then it's about sustaining that relationship. So again, we're investing in the relationship, not just through the process, but longer term, because again, to the systems map, you are expanding and increasing the quality of those relationships and connections so that the outcomes inherently are being driven beyond just the outcomes of this project, but in future projects as well. And so the evaluation is also another key part of this. And in the co-design work, this is adapted from the National Academy of Medicine. It recognizes there's a variety of elements that are key to capturing in this process. The first one is that expanded knowledge. So even expanded definition of what knowledge is, right? It's culturally specific information, it's lived experience. It's also bi-directional, right? The new insights that emerge, what community learns from the experts that are also part of this process, right? So it isn't just one way or the other. Again, the key importance, the sustainable aspect of this, strengthening those partnerships and connections, right? Where you are emerging with new, improved, more reliable relationships and connections as individuals and as community. I have numerous co-designers who leverage this opportunity for their own career development, right? Because suddenly they had an access to a professional network they never had access to before, right? That's part of equity too, is like what does access to connection look like and relational networks. Obviously, improved programs outcomes is another aspect of this, which we, I think, do a pretty good job of assessing. And the concept is if you do all three of these well, you have thriving communities. So you improve health, wealth, power within the community that, again, bridges far beyond any one particular project or outcome. And I think Rochester is a great example of this. I wasn't selling co-design, it was doing it to see it grow and jump to the county and the city and destination medical center and the school district, right? Like it is the exposure and the realization that this brings something of value, not just to the community, but those other stakeholders, the institutions accessing information and connections that they themselves didn't have access to before. And then finally, these are sort of the takeaway foundations of co-design. You don't need to memorize them all. A couple of them that I think are most particularly valuable for this audience, though, is again that lived experience as expertise. We say that a lot in public health, but what does that really mean? And recognizing that lived experience is sort of the other half of the story. And it isn't just about that validation, right? Leveraging lived experience for that exploration. What does that actually mean, right? It isn't, well, they don't see it in the same way, so we need to train, right? We need to persuade instead of be persuaded by that lived experience. It's longitudinal, not transactional. We can have 1,000 focus groups and have, the 30-second snippets from 1,000 different people, but it tends to be really generalized. It tends to be an inch deep and a mile wide, which again is valuable start point for this type of work. But this work's really focused on what happens when given the structure for community, those with the lived experience to be active part of that process. And I always hear from my clients, oh, I didn't realize community members could be so sophisticated, right? Or I would have never thought to think of that or ask that. And that's the whole point, right? Like we've never really actually had a structure to support folks with the lived experience in this type of way. Trust is a power problem, right? It's not a communication or a marketing issue or as our project that we shared, it's not just a flag or a symbol on the window. It is showing up. It is what seeing and feeling my influence over time. It is being compensated. It is being recognized, not just, hey, I was a participant, I was a subject of this work, but I'm a driver of this work. And then finally related to that, that ownership produces the durability. Um, when people are engaged as that conduit, that works both ways, right? Not only to help us understand and hear from community experiences we might not have heard from before, but being able to reconnect back to community, here's how that's being driven and informing what's happening in our community. So that community re-engages because they see a much more equitable way that their experience isn't just at the least just being extracted, and at the worst, being extracted and bent, and the people that are extracting it benefiting, right? Financially, through recognition, those other things. So how am I seeing and feeling my impact in my community through those lived experiences? And so that's like a real crash course in co-design. I offer a version of this at the U for a semester, and that feels pretty condensed. But wanted to make sure that we had some time, and I don't know if there were questions in the chat or anything like that. But I don't know, Mary, how you facilitate the Q&A, but would open it up for folks.
Well, thank you so much, Jess, Atreya, and Holly. I don't think we've got just some general comments, introductions in the chat. I don't think there are any questions yet. But if anyone has something they'd like to ask, you can please feel free to come off mute and ask it, or you can also pop it in the chat.
Hi there, this is Ninik Vu. I'm with the Department of Human Services. We're about to stand up the Medicaid Advisory Committee as well as the Beneficiary Advisory Committee. These are federally mandated groups that we have to kind of develop and to include providers, beneficiaries, caretakers of beneficiaries, and we're trying to figure out how to create the best kind of structure possible to support everyone feel included and able to participate as fully as they can. How do you create safe spaces for people who might have felt historically marginalized and are struggling to say, I can trust people, I can trust to put my information out there, I can trust that this won't be used against me.
Mm-hmm. Atreya, maybe do you want to take a stab at that, being on that side of the equation?
Yeah, for sure. I would say that well, for one, I tend to believe that like a safe space does not exist. Like you can't just like remove systemic violence from a particular place and time, right? Like we're all walking carriers in one way or another of those things. So I guess my thing would be to kind of throw this idea of like creating a safe space out the window. I would say what to make it like a safer space is to really develop transparency and accountability. And so the transparency piece is like, hey, like this is what like we're gonna do with your information exactly. This is where it's going. Do you want to see how it's gonna happen? Do you want to see who's gonna have it? What we're gonna do with it? Like, and that's just one avenue of transparency, right? But you mentioned sharing, sharing information. And then accountability of like if something goes wrong in a space or something something happens either between two people or from the institution to the person or whatever that may be, like being able and willing to confront conflict and hold whatever needs to be done accountable in some way. So like being prepared, don't shy away from conflict or try and like smooth things over. And that's right, that's really hard. We're not taught that in the world at all. And so I would say like you have to be really prepared internally to like deal with that if you were to tackle those kinds of things. And then the other thing I can think of is like you might not get the people right away, like those people who are most rightfully so not trusting of institutions. Like you just might not get them right away. You might have to show consistently like over time that you are a place that can be trusted and try and kind of like build your way in and finding those communities and those people. And so it might take more time as well.
Yeah, I think it's also the time-space structure because like I mentioned, we do those sessions, we do individual check-ins. We really look to curate that relationship and support so that people can show up in the ways that are comfortable. It might not be in even the small group, right? It might be one-on-one, it might be with a peer. So, really, a lot of different ways that people can show up, can share their information. The other thing that co-design allows us to do is because you're a conduit, you don't have to center your own experience, right? You can bring forward other folks' experience, and we never collect, identifiable information through that, but bring those other experiences forward where you're again that conduit, and if you're not feeling comfortable sharing your own experiences in that space, you don't have to, right? Or it can be under the guise of these are some of the things I heard from other folks, right? So that's another sort of strategy is like how do you leverage the people who do show up as opportunities to be conduits, like Atreya said, to connect with folks we know aren't going to show up to that, right? Because they will never feel safe for a lot of good reasons.
Thank you so much for all your thoughts.
All right, the questions are flowing in. I see Renee has her hand up, and then presenters. I don't know if you can see the chat. There are a number of questions there as well. So um, it looks like you can see them. Okay, so I won't read them, but I'll let you kind of manage those as well. But Renee, please go ahead.
Thank you for the presentation. I really enjoyed this. You've given me a lot to think about. I work at the Minnesota Department of Health, and the things that you said about the importance of doing this well and not causing harm, like rushing into a project or not thinking about it or not having it resourced maybe appropriately. That's a question in my mind. I'm curious, what are the ground conditions that you would advise us to have in place before embarking on this journey?
Holly, do you want to maybe take that from an institutional perspective?
Yeah, I think from our perspective, it was really just having leadership support from the get-go that this approach was something we wanted to try. And then also strong partnerships with our community stakeholders in our community health assessment and planning process. Had we not had that, we wouldn't have been able to like follow through as much as we have with this project. And then finally, I think um, not letting fear hold you back, right? Like we didn't know what we were stepping into when we started this project or how long it was going to last, how impactful it was going to be. But we didn't let fear hold us back, and we took some grant funds that we were able to secure and just got started and let our co-designers lead the way, along the path that we've been on for like over 4 years now. So those would be the three things that I'd highlight, I think.
Yeah, it wasn't an intentional, well, this is going to be 4 years, right? I think that is the key to all of this. And I can do a whole presentation on like, that's why the scoping is so important because the other things you want to avoid is, project already too far developed, or it's more about, it's under the engagements under that guise of like, we just need the validation, check the box, right? So it is also knowing when this might not be a good option, right? But being planful about where it can be. And again, more than anything, that means where can, are there like where is the lived experience going to lend something of value we might be missing, and where might it most directly influence some outcome, and that doesn't mean because the other thing is we can't just swing the pendulum like, well, let's just ask the community like what they want. Well, most folks aren't experts in policy making or in developing, public health intervention. So it is again that sort of sweet spot of we need both the sort of expertise, the institutional knowledge, and the lived experience. And so the co-design allows us to kind of work our way within those productive tensions. So that's the other thing is like, oh, whoa, power sharing. I'm not sure we want to embark on that, right? No, it is truly what does sharing look like? That doesn't mean all decisions. It is where can the lived experience actually, influence or benefit this work? And finding, again, by just doing it, you help people feel safe on both sides, right? And recognize the value proposition of like, oh, this is information we can't receive through any other method, right? And so that compensation always comes up as well. Oftentimes, because of some of the limitations with grants and other things, we've learned that like I'm just going to be the consultant and I'm going to pay my co-designers as subcontractors because just like you would hire any other consultant to bring that expertise, we need to treat it in a more professional way. I see Matt mentioned, Holly, what was the biggest learning for Olmsted County and how did the community co-design facilitate it?
Yeah. So I think the biggest learning for us was how impactful or catalyzing this project that we started with would be to our community as a whole. So although our co-designers came up with three recommendations, implemented three strategies, and are delivering them within our community, highlighting this work with our community partners, like caused them to take over 25 different actions across our community to improve access to medical care for those in the LGBTQIA plus community. And that then produced or helped produce measurable positive outcomes from our community health needs assessment. So we're seeing this along with our utilization of collective impact. So now we look at the lived experience side, so co-design, along with collective impact from agencies, as making like a real measurable difference in our community. And so now it's not a pilot anymore. We're gonna adopt that and use it for our next community health improvement plan. So yeah, I think that was the biggest learning, that combining those two things together helped produce additional actions taken and measurable results for residents in our community. So, and yeah, community co-design facility. I mean, it was the whole reason for it. Without co-design, none of this would have happened. So, yeah.
Mary, can we do maybe one more question? I see there's more. We have our contact information on here. I do free consultations with organizations or individuals, so please reach out in addition to this.
Sure, let's take one more question. And I honestly, there are so many great questions in the chat. So thank you all for asking those.
Maybe the
Yeah,
IRB.
I think
Yeah.
the RV one would be great to
Yeah,
answer.
so I worked in the health system before this, so got pretty familiar with the IRB. Um, because of our approach, most of this, unless you're obviously working with vulnerable populations in which, it'll be a little bit different, it's either exempt or what is it called? The um, expedited option because we're not collecting information. The information that our co-designers are sharing is not identifiable other than sort of insights more broadly. If our co-designers want to be recognized, we obviously will allow, like, we want them to participate in the things like this or sharing with leadership. But usually we can get around it through the sort of expedited approaches. It does shift the timeline, right? You have to be thoughtful, but I know most of this material, right? Like here's the recruitment material. We do a position description, like a resume type thing that here's what we're going to use for recruitment. Here's the types of questions we're going to be asking, which are general, not specific to my condition or any, identifiable health information. Here's what we'll be doing with the outcomes. So, I can help give you examples of all of that. But B, most of the time it's just sort of being thoughtful about that, like any project with the IRB early so that you can, engage in that recruitment pretty before you've already started move beyond the opportunity for lived experience to actually be impactful in this work. And then the same with like grants. Grants are really restrictive on, oh, you can't pay community. So again, our workaround has been, use a third party that is, a pass through for our co-designers because they are professional consultants in this work and they need to be treated as such, not just as community members that should be showing up for free because they should care about this, but we will show up because we have a grant to do this work. Yeah, so please reach out. Um, I think this will be recorded. Our slides have our contact information. We can dig way deeper into any aspect of this. We'll have a co-design guide 2.0 coming out hopefully in a couple weeks here. It's just in accessibility check right now. But that's going to be a pretty comprehensive, like, how do you walk through this? What are some of those questions you're asking? What are some of the workarounds you might need to explore, things like that?
Well, wonderful. Thank you. I think Matt Flory, our membership and communications co-chair, is on, so I'm going to turn it over to him.
Yeah, just wanted to thank everybody for coming today. Thank our presenters for a great, engaging presentation. I think we can tell by the number of questions that we didn't get to, which in Minnesota, anytime you get 2 or 3 questions, it's a lot. But we had way more than 2 or 3 questions. So as Jess said, the recording and the slides will be available. So if you have coworkers or colleagues that weren't able to attend, folks, maybe you had to dip in or out, or had, like I did, young children at home that needed to be picked up or had questions about lunch, you can watch the recording later. Also want to encourage people who are not members of the Minnesota Public Health Association, there's the dog, to keep your eyes out for a discount code. We're offering 20% off membership to anybody who called in today and is not a member. So check that out. Visit our website to find out about more informal networking and social opportunities. Thanks, Mary. Back to you.